From personal experience and from what I see from everyone else, our instructors are very, very hands-on.
Athens Tech was phenomenal at training, nurses to be more hands-on than other programs. I've been told that multiple times by most of my coworkers.
Our instructors are amazing. I don't have enough words to say about how just wonderful they are and understanding, and they truly want us to succeed and they want us to be good nurses.
Welcome to Achieve More with Athens Tech, the official podcast of Athens Technical College. This is where you'll discover how the programs at Athens Tech can connect you with in-demand and high-paying careers. Today, we're going to look at the nursing program at Athens Tech with the program chair, current students, and some graduates. So let's get started by meeting our first guest and get an overview of the program.
I am Dr. Andrea Perrin, and I am the program chair for the ASN program, Associate of Science in Nursing at Athens Technical College.
So you're in charge of the instructors and the students. Can you give a brief overview of the nursing program?
Yes, so we have two campuses where we offer the ASN program. Our main campus is at the Athens location, and our satellite campus is at the Walton campus in Monroe, Georgia. And so we have 9 faculty members on the Athens campus and 4 faculty members on the Walton campus. We offer 50 seats per year to incoming junior students and 10 spots per year to the bridge students, which are those students who are LPNs or paramedics that are bridging into the RN program. We offer 30 spots on the Walton campus. So my role as a program chair is to be that contact person for the students and faculty at both locations.
For someone who wants to enroll in the nursing program, do they need to know about nursing or can they just go in cold?
Right in cold. This is an entry-level program. So the students take their prerequisite courses, apply to the program, and they enter day one as brand newbies. We do have some students who have had experience as patient care techs or CNAs, and so they come into the program as well. Credit is not given for those experiences. It just kind of helps them feel a little bit more comfortable around patients, whereas the brand newbies may feel a little bit more apprehensive when they're first going into that role, but it is an entry-level program. So with this program, you finish the prerequisites, come in with us for 2 years, 4 semesters, and complete the program with an Associate of Science degree in nursing. The LPN program is a different avenue that some people pursue, and it is a 1-year program. It's offered only on the Elberton campus. And so with our program, with them coming in entry level, we also offer entry level for LPNs that want to bridge in, and that's with the paramedics as well. And that starts in the summer, and they complete 3 semesters as opposed to the 4.
What should potential students know before they enroll?
I think one of the main things is that we only accept students once a year for the traditional track, which is the 4 semesters. The bridge track once a year as well. So each cohort is only accepted once a year. With that, our deadline is February 1st of each year, and the students must have completed their English requirement, their math requirement, their anatomy 1 and 2, and microbiology. Those are the core classes that are needed to apply to the program. There are a couple of other courses that have to be completed as well, but they do not have to be completed by that February 1st deadline.
My name is Beth Heath. I am an instructor here at Athens Technical College. I am on the Walton campus, and I'm also the clinical coordinator here on the Walton campus.
Can you talk about the program and what are the important details?
So our program is 2 years long. It's a pre-licensure nursing program. So what that means is that we prepare students to get ready to take the NCLEX, which is the test, it's the licensure test for registered nurses. So we're an Associates of Science program. That is an associate's degree. There are several pathways that nurses can take in order to, or that students can take in order to become a nurse. They can get an associate's degree, they can get a bachelor's, they can get a master's or a doctorate. Any of those degrees, once they get that degree, they still have to pass our licensure, which is the NCLEX. And so our program prepares nurses to be ready to take the NCLEX. And so that's what we do.
Is this a starting point for those who want to get into nursing?
So you can certainly start as an associate's prepared nurse and also end. I mean, you can, at the end of our program, when you take the NCLEX, if you pass the NCLEX, you'll be an RN. You'll be a registered nurse. And actually, I graduated from Athens Tech back in 1999. And so when I graduated, I passed my NCLEX and I was an RN. But my goal back then was to come back to Athens Tech and to teach one day. And so I knew that in order to do that, I would have to get my master's degree. And so for me, my education didn't end there. I knew I would have to go on to get my master's. But for lots and lots of nurses, having an associate's that's fine. That's where their educational pathway will end. And they're RNs for the rest of their life as an associate's prepared nurse. But for some nurses, kind of depending on what their goals are, they then go on to get their bachelor's or get their master's. We have several educators here that have their doctorates because that's kind of where their educational goals led them. That's kind of the beauty of nursing. There's so many different things you can do as a nurse, and you can kind of get your kind of pursue your education kind of depending on what your goal is as a nurse.
What goes on in the classroom? There are lectures, sure, but do you work on people or dummies?
Yes, simulators, that's what we call them. Mannequins or simulators. There's a lot of that. And it's very interesting because kind of how nursing education it's really evolving. And I can remember when I was a student here, it really was mostly lecture. And nursing is evolving to where we are doing kind of more of a flipped classroom approach, to where a lot of us are doing more hands-on education. That I love doing that. That's my favorite part. The favorite way to educate is kind of I'll do a recorded lecture ahead of time. The students come into class already having listened to lecture. And then in the classroom, it's totally hands-on. Let's go. I'll tell them, okay, we're going to clinical now. And, we'll get out our stethoscopes and maybe we're working on a simulator in the classroom, or we're doing an unfolding case study, or we might do an escape room. We're working on that. Actually, that was what I was working on with my lesson planning before we started talking. So we do try to do a lot of hands-on. That's application, and that's where a lot of kind of the critical thinking and clinical reasoning skills with nursing develop.
Now that we've met the faculty, let's get to know the students.
My name is Carmen Tucker, and I am a junior nursing student at Athens Technical College.
Carmen, what's your story about enrolling in the nursing program?
So really, since I can remember, I've always been intrigued by the medical field. I've always had a passion for science and math, two things that you really need to be in the medical field. And then also several people in my family have been in and out of the medical field, whether that be hospice nursing, medical records, regular bedside nursing, travel nursing, back to my great-grandmother.
What's been your experience in the classroom?
So in-class learning, obviously it's very intriguing, very interesting. But when you really realize, okay, this is where I'm supposed to be, is when you step foot in your first clinical experience and you have that first patient interaction. Because me personally, I'm coming into nursing school with no prior hospital experience. I was a vet tech. It's not equivalent to being a human nurse, maybe similar in some ways, but definitely not the same. So learning curve for sure, but it was a good feeling to come into clinical and get that feeling of, okay, this is exactly where I'm supposed to be. And the program I'm in, I think, has a lot to do with that as well.
What about the instructors?
From personal experience and from what I see from everyone else, our instructors are very, very hands-on, have great communication. They're typically always in their offices, and we have breaks throughout class. So if something comes up and during the break you maybe want to go pop in, they're not super strict on meeting times or anything like that. They really advocate for us and are really there for us. So, if you pop in, they will help you with whatever, email by email. They even accept messaging or calls in a more emergency situations, or if you can't contact them another way. Something this semester that's different is for mental health. We have these things called tickets in the door, and they're basically through ATI, which is our learning platform that we use. It's all of our tests and all of our bulk of information comes from. It's what our books come from. It's just this platform that I think a lot of nursing schools use.
My name's Tori. I'm a 21-year-old nursing student at Athens Technical College, and I'll be graduating in May of 2025.
Tori, why did you enroll in the nursing program?
I kind of always knew that I wanted to be a nurse, and I took a lot of prereqs at Athens Tech. I knew that the program was very successful and had put out good nurses. I had friends who were nursing students, and they loved it, so it just kind of all lined up perfectly.
Can you tell us about your experience with the instructors?
Our instructors are amazing. I don't have enough words to say about how just wonderful they are and understanding, and they truly want us to succeed, and they want us to be good nurses.
What are you looking to do when you get your degree?
I'm not really sure right now. I'm one of those, some people know what they want to do right from the start, and then other people kind of browse around, and that's me. But the good thing is there's always something that I'll be able to do. I'm leaning towards the ICU or OR route.
What are some other avenues you can go down with this degree?
There's outpatient, inpatient. One thing that I've kind of thought about is like dermatology nursing and doing like dermatology and cosmetic nursing. That is also another option. All sorts of specialties. There's never a job that you couldn't do. There's always job opportunities.
We'll talk with the students again in just a few minutes, but first let's meet our grad.
Hello, my name is Samuel Purdue. I was a recent Athens Tech graduate from the nursing program in 2022, and I currently work at Piedmont Hospital here in Athens in the CVICU unit.
Sam, what made you want to get into nursing?
I always liked science. At first, I started out at UGA after I graduated because I thought that was the cool thing to do since all my friends went there. And I thought I wanted to do pharmacy, but I hated chemistry. And then I realized that I wanted to learn more about the human body. So I love helping people. I think that's one of the best characteristics of nursing is just the caring aspect. So that's what made me like it. And then once I got into Athens Tech's program, it just kind of sparked that fire that's still burning. So I love it.
And now that you're working, what do you do?
So I care for a lot of different patients, but primarily we deal with open heart surgeries post-op from the OR. So immediately as you come out of surgery, I'm one of the first faces that you see, which is sometimes scary, but it is a fun job. I get to experience a lot of things, learn a lot of things, but we don't only just do open heart. We do a lot of other ICU stuff other than just the only thing we don't do is strokes. Anything neuro-wise, we don't do in our unit. Just a lot of different people that I see. I have some great coworkers that I work with. I wouldn't trade it for anything.
How did Athens Tech prepare you for your current job?
Athens Tech was phenomenal at training, nurses to be more hands-on than other programs. I've been told that multiple times by most of my coworkers and higher ups that Athens Tech produces some of the best nurses in the area compared to other colleges when it comes to hands-on experience and clinical experience. So not saying that an associate's degree, because that's all I have. I mean, an associate's degree gets the job done in the nursing field. I see no difference between my associate's degree and some of my coworkers that have their master's in nursing. There's no level of pay increase at my hospital, at least when you first start out. So
did Athens Tech help you find a job?
They did, actually. So the last year of nursing school, or the last semester, you do a practicum, which is basically like, I think it was 180 hours that you had to do of clinical experience in one unit with a preceptor. So I got placed with my preceptor in the same unit that I work in now. So I think during that practicum, you try to do everything appropriately wise when it comes to caring for people, but you also try to get a job where you're getting that experience. So yeah, Athens Tech did help me land the job that I do have now.
Thanks, Sam. Let's talk more about jobs. Carmen, you mentioned earlier about Piedmont Healthcare and how they work with Athens Tech. What's your involvement with them?
So I have an interview actually coming up for a summertime nurse extern position. Basically, just to kind of summarize it or put it in better terms, a nursing student gets paired with a nurse. The nursing student will basically mirror that nurse's schedule and I don't know enough about the skills and whatnot that will be performed, but I know that that student will be paired with a nurse and we'll be trained in certain different things, have a little bit more exposure, assist the nurse in different things, and kind of serves as a summertime learning period, because for associate degrees, we have summers off. We might have some like summer coursework, like book work that they highly recommend for us to do prior to the next semester, but we do have summers off. So that's something that I'm interested in and have set up, and hopefully we'll get a position. And even outside of that, I would love to work at Piedmont as a new grad. I know that Piedmont Athens Regional specifically has a lot of Athens Tech graduates, as well as Piedmont Walton. That's where I'm currently doing my clinical rotations at. And I've met several Athens Tech grads. So that's encouraging in itself. And it gives a sense of security knowing that Piedmont is partnered with Athens Tech and gives a higher possibility of a position after graduation.
Tori, tell us about your job experience.
Between the instructors and then outside parties, we'll kind of connect with each other. And so we'll have people come in and speak with us about different job opportunities. Different companies will come in and speak to us. Like Piedmont will come in and talk with us about different job opportunities. So we're being sought after from our very first semester of nursing school. So we have 3 semesters of different jobs coming in, recruiting us sort of.
Okay, now let's talk money. Instructor Heath, what can nurses expect to be making?
The average salary for nurses now in the state of Georgia, anywhere from $75,000 to over $100,000, depending on where the setting is that they're working. New grads are making anywhere from $35 to $40 an hour, just working day shift right on the floor. That's what we're hearing from some of our partners in the hospital. But shift diffs in the hospital right now for working nights and weekends are really high. There's a pretty severe nursing shortage now, and so nurses going into the hospital setting now can pretty much get the shifts and overtime that they want. So it's a fairly lucrative time to be a nurse. We had some high school students that rotated out recently, or rotated through. They were touring the campus and they were kind of asking about that. And I said, you can make some good money as a nurse, but you can also, because it's hard work. That's the reason why the money is so good. You can get burned out pretty quickly too. So I always say, you have to take care of your mental health. Don't be one of those nurses that's working 5 or 6 12-hour shifts in a week. You'll make 6 figures doing that, but you will burn out pretty quickly too. So
it seems like there was a nurse shortage because of COVID. Is that true?
The nursing shortage started before COVID. It has been coming for decades now, but COVID really, really accelerated.
It seems like there was a nurse shortage before COVID. Is that true?
Not just nurses in the hospital, but all hospital caregivers, and not just caregivers, but any hospital worker. It was a really tough time. And I think, the data showed that it really accelerated nurses leaving the bedside. There is some data showing that nurses are coming back to nursing, but not to the bedside. They're coming to other parts of nursing that is away from the bedside. So hospital nursing in particular is it's not recovering from COVID. So it's a tough time.
Andrea, as the program chair, we want to give you the last word. What should people know before enrolling into this program? It's
not a requirement to be a CNA to enter our program, but a lot of people come in as a second degree. And so with that, they've had they worked in business for 15, 20 years, but they always had a passion for nursing, wanted to go to nursing school. So the opportunity arises and they come in, but then when they get here, they find out it is not what they thought it should be. So my biggest advice would be, if you do not receive a certification as a CNA, at least go in and do some observations where they allow shadowing so that you can actually see what it entails, because it's not just sitting behind a desk or walking down the hall passing out pills. To actually see what the day-to-day life of a nurse is before actually investing the time and money in taking those prerequisite courses and coming into a program and being blindsided. So that the biggest suggestion is, if not receiving the CNA certification, actually shadowing in that role to see how you really feel about it.
Thanks for listening to Achieve More with Athens Tech, the official podcast of Athens Technical College. For more information on the nursing program, be sure to visit athenstech.edu.